Hepatitis A, nicknamed the food and water hepatitis. This type spreads through fecal-oral transmission, meaning contaminated food, water, or poor hygiene can pass it along. Symptoms hit like a bad flu, fatigue, nausea, stomach pain, and that classic yellowing of the skin and eyes called jaundice. The good news is this type doesn't stick around. Your body usually fights it off within weeks to months, with no lasting damage. And yes, there's also a vaccine to prevent it. Hepatitis B. Next is the silent intruder hepatitis. This type spreads through blood and bodily fluids, like unprotected sex, shared needles, or mother-to-child during birth. Many people feel no symptoms at first, but when they appear, patients feel severe fatigue, belly pain, dark urine, and jaundice. The danger is that 1 in 20 adults develop chronic infection, risking cirrhosis or liver cancer years later. The good news is we've got a vaccine that's 98% effective, ideally given right after birth, and if someone does develop chronic hepatitis B. Modern antiviral medications can help control the virus. Hepatitis C. Next is the stealthy saboteur hepatitis. This type spreads primarily through blood-to-blood contact like sharing needles, unsterile medical tools, or even accidental needle sticks can let it invade your system. Most people have no symptoms for years, while the virus silently damages their liver. By the time fatigue, joint pain, or jaundice appear, serious harm may be done. Shockingly, 75% of chronic carriers don't know they're infected. But modern antiviral pills can cure over 95% of cases in just 8 to 12 weeks. Its prevention is straightforward. 1. Never share needles or razors. 2. Ensure all medical and tattoo equipment is sterile. 3. Get tested if you might have been exposed. Hepatitis D. This is the tag-along hepatitis. Hepatitis D only shows up when hepatitis B is already in your system, like an uninvited guest crashing a party and making everything worse. Just like hepatitis B, it spreads through blood and bodily fluids. When hepatitis D and hepatitis B team up, expect more intense fatigue and nausea, higher risk of sudden liver failure, and faster progression to cirrhosis. The scary part is co-infection leads to chronic liver disease in up to 90% of cases. The good news is if you block hepatitis B, you automatically block hepatitis D too. That's why the hepatitis B vaccine is your best defense. Hepatitis C. This is another food and water hepatitis, but with a twist. While most healthy adults shake it off in weeks, for pregnant women, especially in their 3rd trimester, hepatitis E becomes alarmingly dangerous with mortality rates up to 25%. Symptoms hit hard when they appear, crushing fatigue, intense nausea, and that unmistakable yellow jaundice. The scary part is that many people don't realize they're infected until serious damage is done. The good news is that its prevention is refreshingly simple. Boil your water, cook meat thoroughly, and wash those hands like your life depends on it. There's even a vaccine for it, for travelers, food enthusiasts, and especially expectant mothers. Awareness and simple precautions can make all the difference. Autoimmune hepatitis. Now let's meet autoimmune hepatitis, the friendly fire liver disease. Unlike other type of hepatitis we've covered, this one isn't caused by an infection. Instead, it's your own immune system mistakenly attacking your liver like it's a dangerous invader. Here's what makes it tricky. It often starts with vague symptoms, maybe just minor fatigue, joint pain, or mild nausea. Some people don't notice anything wrong until routine blood tests show liver damage. When symptoms do flare up, they can include jaundice, severe fatigue, and abdominal discomfort. The scary part is without treatment, this relentless attack can lead to cirrhosis and liver failure. But here's the good news. Medications that calm the immune system are usually very effective at controlling the disease. Autoimmune hepatitis is more common in women and often appears alongside other autoimmune conditions like thyroid disease or rheumatoid arthritis. Diagnosis requires blood tests and sometimes a liver biopsy. Remember, while autoimmune hepatitis is a lifelong condition, most people manage it successfully with medication and regular monitoring. The key is catching it early before significant liver damage occurs, so if you have unexplained fatigue plus other autoimmune issues, ask your doctor about checking your liver enzymes. It could make all the difference.
Thanks for watching. If you like this video, subscribe for similar ones and drop a comment below. As always, thanks for your support, and I'll see you in the next one.